Good day and happy Sabbath, Church. My name is Dr. Naboth Matinhira. I'm an ear, nose and throat specialist. Today it's Family Ministries Day, so we are going to be talking about genetic disorders. I will start by defining what a genetic disorder is. It is a condition that occurs as a result of abnormalities in the genetic material. And these conditions, they can be passed from parents to the offsprings. The human body is made up of cells. So a cell is the basic unit of the human body. So these cells, they then make up tissues. Tissues, they make up organs. Organs, they then make up the organ systems. And then the organ systems, they then make up the human body. So let's come down to the basic unit of the human body, which is the cell. So right at the center of the cell, you do have a structure which is called the nucleus. In this nucleus, that's where the genetic material is housed. So in humans, we do have 46 chromosomes. So you get 23 chromosomes from the mother, and then you get another 23 chromosomes from the father. So these chromosomes, they can further be broken down into small units that we then call genes. And you can have up to 30,000 genes. So each gene is responsible for a specific function in the human body. For example, there is a specific gene which is responsible for production of a hormone called insulin. So these genes also, they are responsible for the unique physical characteristics that each individual has, and they are also passed to the next generation. So they are important for reproduction. But however, pathology can occur at the level of the nucleus. So you can have complete deletion of a gene, you can have duplication of a gene, and then you end up with abnormalities in the genetic material. So once we have abnormality there, you can then have a genetic disorder. So this is how you end up with a genetic disorder. So in terms of what really causes these genetic abnormalities, in most cases, it's actually sporadic. Okay, they just occur. We can't really identify a specific cause to say that this gene damage has occurred because of this particular reason. But in some cases, you can actually associate an environmental factor. For instance, it could be ionizing radiation. It could be exposure to a certain chemical or to a certain infection. So all in all, we have more than 4,000 genetic disorders. So I'm going to make use of one genetic disorder to take you through how these conditions are approached. So I'm going to discuss what we call genetic sensorineural hearing loss. So this condition, in simple terms, it is hearing loss which occurs as a result of some damage to the genetic material. So when we are faced with such patients, we want to know what their presenting complaints are. What are they complaining of? So in this instance, the patients will probably complain of some level of hearing loss, particularly in early childhood. So we want to know if the language and speech development is actually appropriate for age. For instance, a child who is between 0 to 3 months, we expect that child to be able to open their eyes when they are exposed to some form of loud noise. A child who is, let's say, a year old, we expect them to be able to start to say one or two words. We expect them to respond when their name is called. So if a child is not showing language and speech development that is appropriate for age, it probably means that they actually have some level of hearing loss. We also want to know if there is a family member who is also suffering from a similar condition. We also want to know if there are other possible causes that might explain the hearing loss. And then we examine these patients, but in most cases, when you look into the ear, you don't really see any abnormalities. So we then have to proceed to do specific tests to actually confirm that the child has got sensorineural hearing loss. So there are a number of tests that can actually be done to confirm that the child is not hearing well. Having confirmed this, we now know that we have a child who has been born with some sensorineural hearing loss. We then combined what we got from the history and what found on examination and all these investigations, put everything together to say probably this child has got a genetic sensorineural hearing loss because of the symptoms, and also because there is probably a parent or someone in the family who has a similar problem. But for us to really confirm that this is a genetic disorder, it then means that genetic tests can be done to actually confirm that that particular gene, which is responsible for hearing, is defective. So people have to take a sample from the family member with the same problem, and then they then try and match to see if that same gene is the one with the problem in the child. In terms of treatment, in most of these conditions, the treatment is really supportive. You can't do much to correct the underlying genetic abnormality, but rather the treatment is supportive. In the instance of genetic sensorineural hearing loss, the child cannot hear, so we have to rehabilitate them. So we can give them hearing aids so that they can actually start to hear some sounds, or we can consider what we call cochlear implant surgery. So in a nutshell, this is all that I wanted to share with you about genetic disorders. So what is the take-home message that I want the viewers to know? I want us to appreciate that there are conditions that can be passed from the parents to children. And also it's important for people to undergo genetic counseling if they have a family member who has got a genetic problem. May the good Lord bless you.